And welcome, everybody. Again, thanks so much for being on time and for taking time out of your day to continue to educate yourself. This is another webinar in a series of several that we're doing to help our agents cross-sell to a number of other policies in an effort to, number one, increase loyalty among your clients, because the more policies they have that they depend on you, and the more protection you can provide them to offer a more comprehensive solution, the more likely you will to have long-term clients. And they appreciate the investments that you make in paying attention to their particular needs. And this is where VSP comes in. We actually don't have another vision partner. We've put this off for quite a while. We do have some vision benefits available, combined with some other policies that we have, especially dental policies. But VSP, it has been a great partner of ours through the Quote It platform for many years. And it was high time that we bring a standalone vision plan to our agents that they can add on to any sales that they make in any of the states where VSP is available. Mike Danon is here today from VSP. He's going to help us better understand the products available through VSP, specifically how we go through the enrollment process, and then any other advantages and pros and cons, et cetera, et cetera. So I'm going to turn this over to Mike at this point, and I'm going to shut up. And by the way, Mike, just for your benefit, I will monitor any questions that are posted to make it easier for you to focus, okay?
Great, yeah, because I can't see him. Thank you, Steve. I really appreciate it. And, and welcome to those of you joining this morning. I really appreciate it. My name is Mike Denham. I am based in San Diego. I am on the VSP direct-to-consumer side. And those of you who may not be familiar with VSP, we cover about 80 million folks. So everywhere I've ever worked, I've had VSP coverage as an employee. And many folks know us a lot from the group side, but we're basically in every aspect of healthcare. We supply many of the mandates for Medicare or Medicaid, where there's a vision requirement. We're huge in the group side. We're well known in the broker side, more so on the group, but many folks are just now finding out we have a really good individual product. And we are on some of the exchanges and so forth. So it's a brand your clients should know. It's not for profit, 100% focused on quality and member service. So it'll be a product that's quiet, that your folks will know and they'll be happy with. And there's a lot of opportunity for cross-selling, and we'll touch on some of those opportunities and reasons, because obviously in Medicare Advantage, sometimes there's a vision component built in. But there's still sometimes a lean benefit, and certainly in SUP it's not there, and there's a lot of opportunities to cross-sell. So we'll touch on some of that and the opportunity, and we're just very grateful to partner with AHCP and hopefully give you a really easy-to-use cross-sell opportunity for vision. So I'm going to dig in, and I'll look forward to answering any questions that you have about the product. So talking a little bit about the market opportunity. So, what is the opportunity to bring this to your clients? Where are the holes or the windows here? And what we found is, and again, some of these statistics are even a little dated now because of COVID, but there are so many folks that do not have employer-sponsored vision care as part of their benefits. And we've also got, tons of part-time workers who do not receive their benefits. They're 1099 employees or part-time employees, where they are missing some of their healthcare benefits that they've traditionally had. So there's a gap there. We're also finding, as you know, so many people retiring, some retiring pre-65, so they're in that weird gap where they're not eligible maybe for Medicare yet, or maybe they're just now rolling into Medicare for the first time and deciding whether they're just staying with traditional AB or going MA, or are they gonna buy a SUP plan or whatever it might be. So tons of people rolling in. And then the other big part is, millions of these people have a vision impairment that's not been corrected. So, there's a need here. Not only is there a big group, but these people without the benefit, many of them need the vision benefit. So it's a good question to ask, when you're talking to your client, is to say, do you wear glasses? Do you have a prescription? Are you a contact lens wearer? And so forth. And you'll uncover that many of these people do, or have lost their benefits through their employer or whatever it might be. Now, specific to Medicare, as I touched on, traditional Medicare doesn't cover routine eye exams and glasses. So there's a gap there. If you have a medical issue, that's one thing, but kind of the well eye care piece is not included. Subplans, as you know, generally do not have any vision coverage whatsoever. And many of the MA plans have might have a really skinny benefit. It might be really lean. So it's an opportunity for you to look at your most popular plans that you sell and just kind of go down to the line item on the vision and see how robust that plan is. And if it turns out the plan that you sell a lot has a really lean benefit, selling a buy-up on vision might be a really good opportunity. We already touched on all the folks that are retiring routinely, and also seniors are, as you know, kind of a different animal. They focus on their health care. Almost all of them need vision correction. I mean, once you get over about 40, certainly into your 50s, pretty much everyone has some level of need for vision care and vision impairment and needing glasses or contacts. So it's a huge opportunity. And these folks, they go in, they get their exams, they get their eyeglasses, they plan ahead, they see their doctor. So it really is an important opportunity to look at your seniors and really dig on them as well and their needs. One sideline that a lot of people do not realize is on the well eye exam, the optometrist catches a lot of early onset conditions that may be really important for them to address, like diabetes, hypertension, and high cholesterol. Oftentimes, the optometrist is the first person to catch this because it is caught on that well eye exam that they do. For those of you who have had your eyes dilated and they've got that light in there, they're looking at your eye structure and they can see a lot of these things as an early onset thing. So you may be helping them, detect early onset some of these really, really important conditions. So it's not only you're helping their vision, you might help them catch something early. So there's a lot of incredible value to getting folks in to see their doc ahead of time. Now, one nice thing about the program that we're going to touch on today, it's really, really easy to use. And we'll talk a little bit about how that smart link, this enrollment link, works for you. But once they get enrolled, the nice thing is they can handle everything online. They don't even need an ID card. Once they're loaded into our system, they simply go into one of our providers and they don't even need an ID card to do that. The provider will look them up in the system and take care of their needs. And also we do send them all the welcome materials and so forth. And the enrollment process is maybe 5 to 7 minutes. It's really, really easy to get somebody to enroll in the program. As we were joking about before the seminar rolled out, vision is a different animal than a Medicare Advantage plan. It's much simpler benefit. And the benefits are available the next business day. So there's no waiting period. So you could have a member and one of your clients enroll, in the afternoon one day, and they can go see their optometrist the following day. And it's available year-round, so they can buy it at any point. And it's a great opportunity for you to maybe circle back with them off-cycle. So maybe after open enrollment's hit, maybe it's January, February, they didn't buy any ancillary, but they could use it. It's a great chance to check back in, get in front of them, and see if you've met all of their needs. Now, a little bit about the plans. So what we've put together, there's a couple of plan options for you, and I'll walk you through those just to give you a sense of what they cover and also where they're available. These individual plans are what we call a 12-12-12 plan, and that means every year, every 12 months, they will get their well eye exam, they will get frames, and they will get lenses. And that might look a little different than what they've had on the employer group side, which often has a 24-month period between exams or maybe the materials. So maybe you get an exam annually, but your materials you only get every 2 years. This is a 12-12-12. So they get their glasses, they get their eye exam, or they can get contacts instead of glasses if they want that. But that's done every 12 months instead of 24. So great frequency. And for those that wear contacts, one year they can get contacts, the next year they can get glasses. So it gives a lot of flexibility, and certainly for seniors who need routine well eye exams, great opportunity to get to the doctor annually for those well eye exams, which are really, really important. Now, getting into the specifics of the plan, The standard plan is one of our more popular plans. It is available in all 50 states. So regardless of where you're selling, this program is individually filed in every state. It's available in all 50. And this will look very similar to the next plan I'm going to show you, but it's got a $15 out-of-pocket on the exam and a $25 on materials. It's got a $150 frame allowance, which will allow for a really nice set of glasses, or if they are a contact lens wearer, they can select contacts instead of glasses. And on average, they're going to be saving over $200 on the retail costs of those services. So as you're probably aware, if you just went in to pay cash into an optometrist's office to get an eye exam and frames and lenses and so forth, can get really pricey and is a pretty high out of pocket. This, on average, will save you over $200. So really good full service plan, one of our very most popular plans, and available in all 50 states. The next plan, the base, looks really similar. So this is same thing, 15 and 25 on the out-of-pockets, 150 frame. This one does cover the contact lens exam in full. The other one has a discount in it. This one has the exam covered. So if you're teetering between these two plans and the member's more of a contact lens wearer, the base plan may be a better option for them. This one, the next two plans, this one and the next one, are an association filed plan. So there's a small association fee filed with it, and it's available in 46 states. You can see a little tiny bullet on the bottom. It's not available in Florida, New York, Oregon, or Washington. So if you've got a member in one of those 4 states, I would definitely default to the standard plan, which I showed you previously. If you're in any of the other 46 and they're more of a contact lens wearer and they need that contact lens exam, this base plan may be a better fit. Same thing on the savings. You'll see over $200 savings over retail. And then the easy options is a upgraded plan. So if you've got somebody that's got a more complicated prescription, as an example, wants a higher frame allowance or whatever it might be, the easy options plan might be a better fit. And this one, again, has a 15 and 25 on out of pocket. But if you look to the right, the benefit of this plan is you get a choice of one of the following upgrades as part of this program. You can increase your frame allowance to 230 instead of 150. So if you wanted to pick a nicer set of glasses, this might be the plan for you. Or if you've got a complicated progressive lens prescription, this might be the better fit. This is also an association filed plan, not available in those same 4 states. But again, otherwise coverage, across the whole country minus those 4 states, and just a little bit richer plan that might give them more value if they have a more complicated prescription or whatever it might be. And again, this one's projecting over $300 savings over the retail costs if they were paying out of pocket 100% by buying this program, even after paying for it. So there's definite value in those scenarios, certainly where folks don't have any coverage at all, to buy up one of these programs. So that's a high level summary on those plans. I wanted to include a screenshot of what the actual enrollment site looks like. So what happens is, if you end up contracting through this process that we're talking about today with us and AHCP, you'll get an enrollment link. And when you send this to a client or helping a client and they click on that link, this is what pops up. It's basically our kind of splash page. And you can see there the enter zip code. And all they have to do is simply enter their zip code where they're located, hit the orange See Plans button, and it will pull up the available options in their state and what the rates are and all the detail behind those rates and what the plan, out of pockets are and the coverages and so forth. You will also see on the bottom the network locator piece. So as you may or may not know, VSP has a giant network of practitioners, primarily private practice optometrists, but we've added some retail. I'm going to touch on that in just a minute, but we have an incredible network of providers. So generally access is a non-issue. Unless they're in just an incredibly rural part of the country, they should not have a problem finding a provider. And just as another value, I think, the provider satisfaction surveys, which is really important, are extremely high. So the providers really like working with VSP. We treat them well, and that is reflected in the patient care. That's why our member satisfaction surveys are incredibly high. People have a great experience and really happy with it. And that's because our doctors are happy and they like us. So there's a lot of information on the splash page, but this is what the actual enrollment page would look like. Once you click in your zip code, you'll basically see, again, this is just a sample, but basically it would pull up the available plans and the rates in your state. So as an FYI, it's a 3-tier rate. So it's 1 person, 2 person, or family. So the primary person can buy it for themselves, they could buy it for their spouse as well, or they could buy it for their entire family. So there's a 3-tier rate. You can see the HVA fee. It's a little bit of a micro font here, but you see the monthly rates, and also if it's an association plan, that $1.50 HVA fee that's tied into that. And then down below that, this is only half of the page that they would see, but it would show the out-of-pocket for the well eye exam, the materials information, coverage information. So it's super easy to follow, really easy to understand, and again, gives them the opportunity. As long as they're 18 years old, they can buy a plan and add dependents if they choose. As I mentioned, the standard plan is filed, it's individually filed in every state. The other ones are HVA, association filed plans. I'm sure you guys have seen association filed plans. It gives them some discounts on some services and different opportunities like printing and car rentals and some things. And it also throws some money into some vision-related charities. So for us, it's a way to do speed to market through association modeling versus having to go state by state and file these plans. As you know, it's a lot of work. Now, the locator tool is really simple to use. Obviously, a couple different ways to search by city, zip, name, whatever it might be, and pull up the providers that are in the area. It pulls the contracted locations, information about their hours, their languages, and some additional information. I also just wanted to highlight our Premier program, which is basically our highest level providers. They do the most business with us. They also get some deeper discounts on some of the frames and so forth. So essentially, your client's dollar is going to go farther by going to a Premier provider. So it'll be very clearly marked which of our providers are Premier or not. They're all fully credentialed. We vet them. They're all great providers. It's just the Premier providers are going to give them a little bit better value with some deeper discounts and more volume. They'll have more frame selection. There's just some additional value for the member by going to Premier providers. So really easy to use it using the mapping piece and just kind of a summary of the tool. And as I mentioned, we really do have a giant network, and access should be really, really a non-issue for your clients. One other piece that is pretty new to VSP is the acquisition of Visionworks. So we didn't really have retail. We've been very focused on private practice practitioners. But the reality is some people do like going to a kind of brick and mortar locations and into a strip mall or whatever it might be. So we really looked around and found that Visionworks was just a really high quality, great organization, and ended up partnering with them, which provided us 700 additional locations across the country. So you'll see some higher penetration in other areas. I happen to be in California, so California is an area where they don't have penetration. But I was in Texas on a business trip, and just in one business trip, I probably saw 5 or 6 Visionworks locations just driving around to and from meetings. So depending where you are, it's just another option to provide access to folks. And they do tremendous business, really good high quality organization, and was just a real additional benefit to increase access and round out kind of our offering and give people more choice. Another thing about Visionworks, great guarantee as far as member satisfaction. So, they're very good about if you're not happy with your glasses, you've probably seen the TV commercials. They will make sure that they get it right, and they will fix that. They have a huge selection of frames, very high member satisfaction scores, just like we do with our overall member sat surveys. So the experience should be really good. And again, for the folks that like more of a retail setting where you can make an appointment or you can just walk in, it just gives them more options. One additional piece, and interestingly now with people getting used to more online shopping since COVID's hit, we also have an online presence. So Iconic.com has been a part of VSP for a while, but I think as all of us have moved into more of a virtual world, and certainly boomers and younger folks, millennials who are aging in and getting into benefits are used to doing more online shopping, Iconic is another great opportunity for them. Once that client of yours has their eye exam and a fresh prescription, they can go to the Iconic.com site and they can purchase glasses, have that materials component of it fulfilled online and do the shopping online. There's a virtual try-on for the glasses. There's a huge selection of our frames and gives them a lot of people like to online shop. So it's a great opportunity. Again, more access for the folks that don't want to go out, get in their car and go somewhere after they've had, as long as their eye exam is new and fresh, they can go get the fulfillment done through our Iconic.com portal. And the nice thing about that is this site right here, or this piece, once they put in just a little bit of information, it will sync up their benefit and essentially, figure out what the coverages are. And then as you are shopping for frames, it will show you what the out-of-pocket is. So based on whether you have the 150 frame allowance or whatever it might be, it syncs up your benefit and certainly helps with the shopping experience. So as you're going through, you'll know what the costs are for you. It won't be one of those, oh, wow, what a surprise at the end. I had no idea these were $400 frames and I had a giant out-of-pocket. This will help you navigate that for the online shopping experience. So just another good access point for folks, especially that like to do online shopping. Now, one of the benefits of VSP is certainly the member satisfaction and the communication part. So the great thing is once someone is enrolled in our program, we really handle everything from there. So we do what we call a lot of member nurturing. So this is truly written as an individual, it's underwritten as an individual product, meaning we understand if someone buys it, they're going to use it. And so it's not underwritten like a group product where you think 5 to 7% of the people are going to use it. They do risk sharing and et cetera. This is underwritten as an individual policy. They know people are going to use it. We want people to use it. We know people won't retain it if they don't have a good experience, if they aren't using it and enjoying the benefits. So we do a lot of member nurturing to tell people about their benefit. Send them a welcome kit, tell them about special offers that we might drop throughout the year, like extra money off on a second set of frames or whatever it might be, know about your eye health or whatever it might be. So we want to touch them. We want to get them to use it. We want them to have that VSP experience. And we will also handle all of the renewals for you. So our goal here as a partner is that we provide you as a reseller a really good product, high member satisfaction, something that'll be really quiet, something you don't have to touch. You just receive your commission on it. It's quiet. People are happy with it. So we handle all the renewals for you. So we do all those things to make life easy for you. We understand that the dollars on a vision product are nowhere near something like a Medicare Advantage product. So we want to make it easy. So these are some of the things that we do. Again, the cancellation prevention component, one thing to highlight is we show monthly premium rates on there, but they are signing up for a 12-month program. So they can't buy the program, pay the first month, go down, get their eye exam at $200 set of frames and spend $500 on materials and then cancel it the next month. They are signing up for a 1-year policy. So we do a lot of work as far as the recovery on that. So we do appreciate you letting them know that on the front. They can actually pay for the whole program up front for the year, or they can do monthlies, but they are committing to an annual policy. But we have a whole retention component of that to address that. And it's, again, to make life easy for you as a reseller. Now, I'm basically wrapping up here. So some of the takeaways that I think are important value props or takeaways for you as the resellers are, as I mentioned, that the enrollment is available year round. So you don't have to just bring this to your clients during the open enrollment period or whatever. This is an individual product and is available to anyone who's 18 years or older. So you can sell it to anybody who's new, who doesn't have coverage. It could be somebody young, somebody Medicare age. It doesn't have to be in any particular time of year. As mentioned, the product is available the next business day, so there's no waiting period. In way of background, the rates are state-based. They are not age, gender, or health status rated. So what you'll see is that same plan, like if we took an example of the standard plan, you might see that same plan cost one rate in Texas, and it might be $1.50 more in California, whatever it might be. So the rates are state-based. Doesn't matter how old they are. It doesn't matter whether they're male, female. We don't ask any health status questions. So it doesn't matter whether they have diabetes or any other health conditions or comorbid conditions. So it's simple in that respect. And there'll be a couple of dollar swing between states. And certainly as you get into the 3-tier, so if you're adding a spouse or you're adding family, you know, that gap gets bigger. But generally, if you just looked at a apples to apples individual policy, the same policy in different states, you might see a $2 or $3 swing between Minnesota and California, or Texas and Florida, whatever it might be. So it keeps it simple in that respect. As I mentioned, they can pay for the 12 months up front, or they can make monthly payments, but they are coming into the 12-month period. As mentioned, benefits can be used next business day. Again, 3-tier policies. So they can, as long as they're 18 and they're of age, they can buy it for themselves or older. If they're a dependent, they follow the same typical standards around aging off at 26, just like other benefits do. And then, as I touched on early on, there is significant savings over the retail costs, even after paying for this plan. So even though they're paying the premium, if they just went in and paid retail for these services, they're still saving on average $200 to $300 out of pocket by buying a program. So certainly anybody who is without a benefit would really do well with this. As mentioned, you've definitely got some of the MA plans that have a really skinny benefit. So as you know, like in the MA space, every year they've got to file their benefits every year with CMS, and they've got to fight over every penny, whether they're doing transportation or meals or whatever it might be. And sometimes you'll see those benefits like dental and vision getting skinny down or really brought down. So they check the box and say they have it, but is it really going to meet your client's needs? So that is just one kind of piece of advice: is take a look at your favorite few MA plans and look at the vision benefit, and is it rich enough to really meet your needs for the folks that have MA? If they're a sub-member, that's a slam dunk. They don't have anything. And certainly there's lots of just individuals that you might work with that are part-time employees or whatever it might be, and they just don't have any benefits at all. So for anyone who's got a vision issue, buying a standalone vision program should be a good value proposition for them, and certainly value for them. And finally, the selling link. So if you'd like to participate and do this, you can certainly work with AHCP. I'm sorry, Steve, I just butchered that. I'm only one cup of coffee in. And you can reach out to them, and they can help facilitate getting that selling link. And essentially that link is a personalized link that you will get from them, and you can simply work with your clients. You can email that to them, you can post it on your site, however you reach your clients. That link will be what you saw on that splash page. So they would click that link, all those sales track back to you and the organization. And from there, based on where their state is and their zip code, the available plans and the pricing will come up for them. So that's a high-level summary of the program and the value proposition. I'm right on 30 minutes as I hoped.
That was great, Mike. Thank you so much. I really appreciate them. Great information. I love the fact that you have the well visits available. And just as a reiteration that this is a great product to add on to any med sub sale, especially any other core health products like major medical through the ACA or short-term medical for sure. Give them some nice well-rounded coverage. I do want to remind everybody that this whole presentation will be available on our online pre-recorded training section on the website at ahcpsales.com. All right, well, thanks everybody for attending today. I really appreciate your attention. Mike, thank you very much. And I look forward to doing this again sometime soon.
Really appreciate your time. Thank you much for the partnership.